Hello everyone. So today we will talk about the lymphatic system. Okay. So as you know, this system is another accessory system. Like you have the arterial system, venous system, then you have the lymphatic system in the body. So we will understand this system in quite detail, and this is very important. Clinically also there are many entities which are linked to this. You will understand in a while. And there are certain short notes which are asked from this topic. Okay, so without a further ado, let us begin. So we have certain competencies from this topic, as you can expect, that is to understand and the components and functions of the lymphatic system. Then we will understand the structure of the lymph capillaries and the mechanism of lymph circulation. Then we will also understand the concept of lymphedema and also spread of tumors via lymphatics and versus the venous system. So these are all the competencies for us to appreciate. So let us begin with this topic. So let us introduce this topic first. Introduction. Okay, so this lymphatic system, it actually comprises of extensive network of lymph vessels. Very important to understand. It's an extensive network of lymph vessels which drain the extracellular fluid. I hope you have understood this in the physiology part. And it also acts as a accessory system to the venous system. So acts as accessory to the venous system. Okay, this is very important for you to understand. See, a conceptual understanding is very essential for this system, otherwise you will be stuck in your viva. Okay, so let us understand further what are the functions of this system. Okay, so number one, to drain the excess extracellular fluid only, to drain the excess, or I can say extracellular fluid, okay, to the venous system. I will show you in 3D how this lymphatic system is connected to the venous system. You will be really surprised. Okay, and then number two, to filter the absorbed fluid and material. Okay, so it also acts as a filtering mechanism here. Okay, then to absorb the fat from intestine, absorb the fat from the intestines. Okay, and also transport it to the blood. Okay, then to provide defense mechanism, very important, provide defense mechanism. Okay, against what? Against the disease causing microorganisms. Okay. So let us understand further what are the components of lymphatic system, and as you know, this is one of the competency also, so please pay attention. So components of the lymphatic system. All right, so let us list them first. You can see most of them on the image. Number one, that is the lymph itself, very important. Number two, the lymph capillaries, the lymph capillaries, okay, and the lymph vessels. We have the lymph vessels. Number four, the lymphoid organs. We will understand in a while what are the lymphoid organs we have. Number five, that is the epithelio-lymphoid system. Epithelio-lymphoid system, and last but not the least, that is the bone marrow. Okay, so let us understand, highlight here what all we have. So we have the lymph nodes, okay, the lymph vessels, you can see here, lymph capillaries, okay, the lymphatic ducts, okay, and the lymph itself, right. So you can appreciate what is happening here. If you notice, this is the this is the right atrium, left atrium, right ventricle, left ventricle, which you can appreciate here. So this heart is shown here, and you can see connection to the lungs is shown here. Okay, this is the lungs. Now you can appreciate what is happening from the left ventricle. What happens? We have the blood which is pumped out, okay, through the arteries, and then via the blood capillaries, the blood again transfers to the venules and finally to the veins, and then it comes back to the heart into the right atrium. So this basic stuff we have already discussed last time, if you remember. So and what is the channel here regarding the lymph? So you can appreciate some of the lymph capillaries which are connecting to this network here, and the extracellular fluid is being taken up by these lymph vessels, and then further through the lymph nodes, and you will study a lot of places, the lymph nodes, the lymphatic drainage, and then the final drainage into another lymph node, and then finally it goes into the lymphatic duct. We have one on the right side, one on the left side, we will discuss in a while. And then you can appreciate a very important point here, this lymph is also draining into the vein only. Okay, so that is very, very important to understand here, okay, regarding this lymph. So now what is this lymph? Lymph is the fluid that flows through the lymphatic vessels and the lymph nodes. Okay, so let us write one by one about each of them. Number one, that is the lymph. So lymph is a fluid that flows through the lymphatic vessels and the lymph nodes. Okay, so it's a pale, clear, watery fluid. I am writing the keywords so that you have everything on the notes. Okay, so pale, clear, watery fluid which is generated from the extracellular fluid, that is known as transudate. Okay, so this is generated from the extracellular fluid, okay, or I can say transudate. Okay, and this contains the plasma proteins, contains the plasma proteins, okay, and this also contains the WBCs. Okay, so it also contains the WBCs, that is the white blood cells. We have discussed this also last time, if you remember. And out of these WBCs, predominantly speaking, the lymphocytes, Okay, so also this lymph, it contains large fat molecules, also has large fat molecules, and these molecules are known as chylomicrons. You might have heard of this. Okay, these are absorbed from the intestines. Okay, so such lymph which contains the large amounts of fat molecules which looks similar to the milk, and hence it is also known as chyle. Okay, so lymph containing large amount of fat, having large amount of fat molecules, looks similar to the milk. Okay, hence it is called chyle. Okay, so lymph can also contain cancerous cells, viruses, bacteria, foreign materials, okay, dyes, okay, all these things can be a part of lymph. So we have understood chylomicrons and chyle here. Okay, and it's generated from ECF or transudate. Okay, then let us understand the clinical integration here. I will keep on adding the clinical integration wherever possible. Okay, so first one, that is the lymphedema. Okay, so let us note this down. We have this, that is the lymphedema. Okay, lymphedema. Please check the spellings, okay, so that you remember them. Write lymph, then edema. Okay, so in certain textbooks you will find edema or oedema, that is both are okay. So lymphedema is accumulation of excess lymphatic fluid in the tissue which leads to the swelling. Okay, so accumulation of excess lymphatic fluid in tissue. Okay, so it typically, this lymphedema, it occurs in the limbs. Okay, so it occurs due to the failure of the lymphatic drainage, and the most common causes of lymphedema are like filariasis. Okay, so causes you can write the filariasis. Okay, that is infection by the parasite which grows and blocks the lymphatic vessels. Then other kind of infections, okay, trauma, cancer cells, okay, and various surgeries. Okay, so this is the first one, that is the lymph. Then we discuss about the second component, that is the lymph capillaries. Okay, lymph capillaries. So this lymph capillaries, it begins in the tissue as blind ended sacs. Okay, so they are blind ended sacs. Okay, so this is similar to the endothelium of the blood capillaries. So lymphatic capillaries, they are lined by lymphatic endothelium. They are lined by lymphatic endothelium. Okay, so they are more permeable than the blood capillaries. That is very important. It is more permeable than the blood capillaries. Okay, and therefore why this is important, because this will permit the entry to absorb the larger lipid molecules in the intestine. It will permit larger lipid molecules okay in the intestine. So most of the tissues in the body, they have the lymph capillaries. Okay, then we have the next, that is the lymph vessels. Okay, lymph vessels. Acha. Another thing regarding the lymph capillaries, that is the lymph capillaries, I told you they are mostly present in all the tissues of the body, but there are few exceptions which we need to understand. Present in most of the tissues. Let us note the exceptions. So what are the exceptions? So that is the epidermis, cornea, cartilage, hair, nails, the splenic pulp, we will read in a while, splenic pulp, the bone marrow, choroid, then internal ear, meninges, and the nervous tissue. Okay, so these are some of the very important exceptions which you should be able to remember. Okay, so that is regarding the lymph capillaries exceptions. Okay, so then there is some difference between the lymph capillaries and the blood capillaries. Okay, so let me show you another image to understand this. So you can see here, this is the lymph capillaries which are shown here, green color. Okay, and you can see the interstitial fluid, that is the extracellular fluid. This is the lymph node. We have the lymph vessels with the valves, lymphatic duct, and it is finally draining into the vein. Okay, so this basic infrastructure we should be able to understand. So see, regarding the differences between the lymph capillaries and the blood capillaries, that is the lymph capillaries, they begin blindly in the intercellular spaces, as you can see here. Okay, so we can write somewhere the difference between the lymph and the blood capillaries. Okay, number one, that is lymph capillaries, they begin blindly in the intercellular spaces. Number two, we have, that is they have a larger and irregular lumen. Okay, and we also wrote another difference, that they can absorb larger molecules okay and even the microorganisms also. Okay, so this is the difference here. We are actually talking about the lymph capillaries की तारीफें. ठीक है, so we are talking about the lymph capillaries, so you should be able to understand. Next, so most of the lymph capillaries, as you can see in this photo also, they carry the lymph towards the lymph nodes. Okay, so but that is through what channels? That is through the afferent. Afferent means आने वाला. Okay, so afferent lymph vessels. ये न्यूरो में भी concept आएगा efferent afferent, but अभी यहाँ पे भी याद रखो. So this is afferent lymph vessels, जिससे lymph is coming. Lymph leaves the lymph nodes through the efferent lymph vessels. So let me mark this here. We have a very important concept here. These lymph vessels with green color I am marking, and this I am marking with blue color. Okay, different color ले लेते हैं, brown ले लेते हैं, ठीक है, just to differentiate. Okay, so this green one, this one, this is the this is the one which is the afferent lymph vessel. Okay, so this is the afferent lymph vessels. Okay, whereas this one which I have highlighted here, this is the efferent lymph vessel. Okay, so you can see afferent which is entering into the lymph node and efferent which is exiting the lymph node. Okay, simple concept, basic understanding. Then we come on to this concept of the lymph vessels, the larger lymph vessels. So you can see here, this image is very important again. So we have a concept of larger lymph vessels. Okay, so please remember. So this this larger lymph, the larger lymph vessels, they are the one which have very beaded appearance, as you can see here. If let me show you in this image, you can see this beading. Okay, ऐसा लग रहा है कोई मोती है अंदर, ठीक है. So beaded appearance is there. So this is very important and it is asked in viva also. Okay, so they have a beaded appearance. They have a beaded appearance. Okay, why? This is very important for viva. Okay, so let us understand. So this is due to the presence of numerous valves within their lumen. Due to the presence of numerous valves within their lumen. Okay, so this helps to maintain the unidirectional flow. Okay, so this is extremely important to understand regarding the beaded appearance which you will find here. Okay, if I highlight it here only, you can see this one. Okay, this is having a beaded appearance. Okay, here all throughout, right? Okay, then we come on to this understanding that lymphatic vessels, which we understood, they bring the lymph to the series of lymph nodes. Okay, we saw in the first image if you remember, and these lymph nodes are the one which filter the fluid to remove the foreign particles and the microorganisms. So smaller lymph vessels, they will merge to form larger lymph vessels. So what are the larger lymph vessels which includes? So let us understand. So the larger lymph vessels, it includes We have thoracic duct, the most important one. Let me change the color for this. Thoracic duct, okay. And the right lymphatic duct. These are the two main ones, okay, which you cannot miss. Then you have the jugular lymph trunk, okay. We have the jugular lymph trunk, left and the right jugular lymph trunk, okay. Then we have the subclavian lymph trunks, right and left, okay. Then we have the bronchomediastinal lymph trunks, okay, right and the left. Then we have the intestinal lymph trunks, okay. Then lumbar lymph trunks, okay. So these are certain important ones which you have to remember for the larger lymph trunks, okay. So let us come to the another one which is very important, that is the thoracic duct. You can get a short note on thoracic duct also from general anatomy if there is a theory exam. So please remember this topic well. This short note as well as for viva, okay. So this thoracic duct, let me first show you in 3D, you will get better understanding. If we bring up this venous system, the lymphatic system, okay. So venous is important, otherwise you will not get orientation. So I need to remove this sternum here, thymus bhi hata dete hain. So now see this, you can see the beating heart and you can see the veins, the two main veins, that is the left and the right brachiocephalic veins, okay, which you all know they both will drain into the superior vena cava, okay. I hope it is clearly visible, yes. So now please pay attention here in the neck region, okay, this is the neck region. Here in the neck region, very important vein is there, you will understand in better detail in a few classes, that is the internal jugular vein, okay, on either side, right and left. And here you have the, you can see this is the internal jugular vein which I have highlighted here, and this is the subclavian vein and this is the brachiocephalic vein. So this is the jugular inferior jugular bulb. So internal jugular vein and the subclavian vein, they both are draining into the brachiocephalic vein, okay. So this is some basic understanding. Now see here, very important point, I am zooming in, you can see this is the right lymphatic duct, okay, which is just this small piece, we will talk about it in a while. You can see if I isolate it, it's just this much in the entire body, okay. So this is known as the right lymphatic duct, okay. This is entering into what? This is entering into the jugulo-subclavian angle only. So we saw this is the subclavian vein, this is the jugular vein. So jugular vein and subclavian vein angle, there is an angle. So at that angle, this is entering, that is the right lymphatic duct. Similarly, compare this to another one, that is the on the other side. Let me show you here. This is a bit different. This is very important. Again, same story, subclavian vein, jugular vein, and here you have this is the thoracic duct. Again it enters into the jugulo-subclavian angle only, but this is the thoracic duct. Now let me show you in isolating mode. See how much big it is. Length, just have a look at the length of this thoracic duct. So this is the largest lymphatic vessel in the body. Very important. It is 45 centimeter in length and 5 mm in width, okay. So we will talk about this now. Thoracic duct, we have seen in 3D, okay. So key points here, it is the largest lymphatic vessel, okay. It is the largest lymphatic vessel. You can see it is here shown in this image, thoracic duct, okay. And this is the angle which I was talking about, this angle, okay. So subclavian vein and internal jugular vein, so at this angle this is entering, okay, and it is about 45 centimeter in length, 45 centimeter long, 5 mm wide. Okay, and very important, as you know, it has a beaded appearance. So now you know why it is, and it is asked in the viva also. It has beaded appearance. Okay, so we know this. I am not writing again. So this is due to the presence of numerous walls. Okay, now very important, the formation. Okay, so formation is extremely important to understand here. Okay, so talking about the formation, the thoracic duct, it begins, now you see this is beginning from below. Okay, so from here it is ascending here. So here we have a very important structure. Let me highlight this. This is a cisterna chyli. Okay, so thoracic duct begins as the continuation of the upper end of cisterna chyli. Okay, and this is present at the lower border of T12 thoracic vertebra. Okay, so you can see that also in this image. So this is present at the lower border of T12, and this is an MCQ. Okay, now this enters the thoracic cavity and ascends upwards. Okay, so that is regarding the formation. So it is beginning as the continuation of the upper end of cisterna chyli. Continuation of upper end of cisterna chyli. Okay, then termination, I will show you in 3D, don't worry. Then talking about the termination. Okay, so that we have already seen in 3D. The termination. So it opens at the left jugulo-subclavian angle. Very important, left is important because right में right lymphatic duct है. So left jugulo-subclavian angle. ठीक है, so that is junction of the left internal jugular vein and the left subclavian vein. Talking about the very important area, that is the area of drainage. Okay, so very important. Area of drainage. Now, what all regions in the body it is draining? It drains all the lymph from the all the parts of the body except, so now there are certain exceptions. Okay, so what are there? It drains okay, like let us do one thing. I will write here, refer to the image. Okay, so you can see this image. So this thoracic duct is the one which is draining the most of parts of the body except, now what are the exceptions? That is the areas which are drained by the right lymphatic duct, as you can see in this photo. Okay, so what are these? Let us understand. The right of the head and neck, right upper limb, right side of the chest wall, right lungs and right side of the heart, right surface half of the liver. Okay, so this is something which is to be understand, okay, by you, that is majority of the area in the entire human body is taken care by the thoracic duct, because it is obvious reason, because it is the largest lymphatic channel. Okay, then we talk about this, that is the smaller one, right lymphatic duct. Right lymphatic duct. Okay, so this is a large lymphatic duct which is present on the right at the root of the neck. It is present on the right side at root of the neck. We have seen in 3D again. Okay, the people who are only relying on the notes, so they should have this written ताकि वो video देखें and then you should realize, okay, that it is also important to see the video along with it. So it is about, what is the length? It is about 1 centimeter long. Okay, it is about 1 centimeter long, and this is formed by the union of right jugular trunk, number 2 right subclavian trunk, okay, right subclavian trunk. Number 3, that is the right bronchomediastinal trunk. Bronchomediastinal trunk. ठीक है. Talking about the termination again, so ये तो हो गया formation. Okay, let me just wait. So this is formed by the union of, okay, so we know the formation now. Then termination, same headings mein we are discussing it. Termination, so in the neck it opens at the, in the neck we already studied. In the neck, okay, at the right jugulo subclavian angle. Okay, so that is the junction of the right internal jugular vein and right subclavian vein. Okay, then areas of drainage, so that we can see in the photo only. Why I am telling you in these headings? Because if the short note comes in your exam, so you have to write these headings. Okay, otherwise you won't be getting any marks. Okay, so this we have already discussed. Then we come on to the next topic, that is the superficial and deep lymph vessels. Okay, so lymph vessels can be further divided into, the lymph vessels, they can be further divided into 2 categories according to the locations. So that is the superficial lymph vessels and the other one is the deep. Okay, so superficial, they are present in the superficial fascia, and deep lymph vessels, they are present deep to the deep fascia. And the deep lymph vessels, they are the one which is mostly accompanying the blood vessels. Okay, so then there are certain factors which help the lymphatic drainage. Factors helping in lymphatic drainage. Okay, so what are these? Let us understand. One is the skeletal muscle contractions. The skeletal muscle contractions. okay, which create the pressure of the lymph vessels. Number 2, the walls in the lymph vessels, okay, which maintain the unidirectional lymph flow. Then contraction of the smooth muscles, and in the wall of the lymph vessels. Then pulsations of the adjacent arteries, very important again, okay. Then negative intrathoracic pressure which is created during the respiration. So negative intrathoracic pressure. Then we have the movement of diaphragm during respiration, and last but not the least, that is the elevating of the limbs, that is the gravity, okay. So these are certain important factors which help in the lymphatic drainage. Then we come on to the another concept, that is the, which is again as per the competencies, if you remember, the lymphoid organs, okay. So let us talk about the lymphoid organs. Okay, lymphoid organs. So there are lymphoid organs are also made up of lymphoid tissue only, okay. So lymphatic tissue, it is a specialized form of connective tissue only, and this consists of immune cells like the lymphocytes, plasma cells, the meshwork of reticular fibers and the cells, okay. Then lymphoid organs, they can be classified into primary and secondary lymphoid organs, okay. So let us make this flow chart to understand things better. Okay, so one is the primary and another is the secondary. Okay, so first one, that is the primary lymphoid organs, and the other one is a secondary. Okay, so the primary lymphoid organs, they are also known as central lymphoid organs, okay. They are also known as central lymphoid organs, okay. These organs, they produce the immature lymphocytes from the stem cells or the immature cells. And what are the examples? So that is the thymus and the bone marrow, okay. So they are converting the stem cells into the immunocompetent, or I can say immature cells, okay. So they convert the stem cells into immunocompetent cells. Immunocompetent cells, ठीक है. So examples, classically viva में examples ही पूछते हैं, that is the thymus and the bone marrow. Okay, then you have this secondary lymphoid organs, that is the these organs which provide the exposure to the foreign antigen, and they convert the immature lymphocytes into the active lymphocytes, okay. So I can say these secondary lymphoid organs, they are the site for activation and proliferation activation and proliferation of immunocompetent cells of these immunocompetent cells. So what are the examples of these secondary lymphoid organs? That is the spleen. Examples: the spleen, okay, lymph nodes, tonsils, appendix, and the Pierce patches. Okay, so that is the MALT and all those we will discuss in a while. Okay, so this slide contains very important information regarding the thymus and bone marrow, which are the primary ones, compared to the spleen, lymph nodes, tonsils, appendix. These are very important examples for the secondary ones. Okay, so now let us understand another concept, that is the diffuse and dense lymphoid tissues. Diffuse and dense lymphoid tissues. Okay, so number one, that is the diffuse lymphoid tissue. So the lymphocytes, they are distributed throughout the mucosa of the gastrointestinal tract, respiratory tract, urinary tract, and the reproductive tracts. So this type of lymphoid tissue is known as the diffuse lymphoid tissue, and diffuse lymphoid tissue is not enclosed within a capsule. So please remember, it is not enclosed within a capsule. Okay, so as this lymphoid tissue is associated with mucosa, so it is known as mucosa associated lymphoid tissue. It is known as mucosa associated lymphoid tissue, MALT. Okay, so ileum is the most common site of MALT. Ileum is the most common site of MALT. Okay, some authors also consider the MALT as dense lymphoid tissue, but stick to it as the diffuse one. Okay, then this diffuse lymphoid tissue, it protects and provides immunity against the microorganisms coming in contact with the mucosa. Then we have the dense lymphoid tissue. The dense lymphoid tissue, this is enclosed by a well defined capsule. Enclosed by well defined capsule. Okay, and this includes the discrete lymphoid organs, which mentions the lymph nodes, the spleen, thymus, very important, and tonsils. Okay, so diffuse one, please remember, it is not enclosed within the capsule. We are giving an example, that is a MALT. And dense one, it is enclosed by the well defined capsule. Example: lymph node, tonsil, thymus, and spleen. Okay, so this is the difference between the two, and you should be remembering them. I highlight them, that is a MALT, not enclosed within the capsule, compared to well defined capsule, enclosed by a capsule. You have lymph node, spleen, thymus, tonsil. These all are very important histological slides which you will read about in further classes. Next we can see in this photo, that is the lymphatic nodule, or I can say a follicle. Okay, so what is this lymphatic follicle? This is a well circumscribed, as you can see, in a circular manner. It's a well circumscribed, circumscribed concentration of lymphatic cells. Okay, so please remember this very classical definition. The lymphatic nodule, this is a well circumscribed concentration of lymphatic cells. Okay, and this lymphatic nodule, this is not surrounded by a capsule. Okay, so it is not surrounded by a capsule. Okay, so I can say it's a spherical or a void mass, and it is present in all the dense lymphoid tissues except thymus. Okay, so you can write this is present in all. It is present in all dense lymphoid tissues, which we just listed previously, except thymus. You will see the slide of thymus, you will not find these. Okay, so very important classical MCQ. Okay, so then there are two types of lymphatic nodules. One is primary and secondary, although you don't need to go into too much detail about it. Okay, then we have the another thing here, that is the germinal center. Okay, so you can see this entire pale staining area in the center of this lymphatic nodule. This is the germinal center, and this is something which we will study in detail in the histology. Okay, next we come on to the lymph nodes. And lymph nodes will be something which you will keep on hearing whole throughout the year at multiple places in the body. Okay, so what is a lymph node? It is a kidney shaped structure that filters the lymph. Okay, it's a small kidney, or I can say bean shaped structure which filters the lymph. Okay, so there are about 450 lymph nodes in the body, out of which 60 to 70 are in the head and neck and upper limb region, 100 are in the thoracic region, and about 250 are in the abdomen and pelvis and the lower limb. Okay, so the lymph nodes, there are main lymph nodes of the body which are named as per the regions only, as you can see in this photo also, like the axillary lymph nodes in the upper limb, in the axilla region, axilla armpit region. Okay, then inguinal lymph nodes in the lower limb. Okay, cervical lymph nodes in the head and neck region. Okay, mediastinal in the thoracic region. Then you have aortic lymph nodes in the abdomen region, iliac nodes in the pelvic region. Okay, so these are some of the very important lymph nodes. And the superficial lymph nodes, they lie in the superficial fascia and they are arranged along with the veins. Okay, that also you study in detail in the head and neck region. The deep lymph nodes, they are located deep to the deep fascia and they lie along the arteries. Okay, so that is the classical difference between the two. Let me just write here. Superficial lymph nodes, they are in the superficial fascia, and they are deep to deep fascia. Okay, so number one, this is the thing difference. Then they are arranged into the arranged along veins. Veins are superficial and they are deep ones are arranged along the, they are arranged, or I can say they lie along the arteries. Okay, they lie along the arteries. Okay, arteries are deeper. So please remember this. Okay, and the superficial lymph nodes, they drain into the deep lymph nodes. Another thing, yes, the superficial ones, they drain into the deep lymph nodes. ठीक है, ये basic understanding है which you should be having. So what are the functions of the lymph nodes? I hope you already are aware of them. That is the filtration of the lymph, number 1. Filtration of the lymph. Number 2, that is presentation of the antigens to the T cells. Oh, sorry. Presentation of antigen to the T cells. Number 3, we have activation and proliferation. Activation and proliferation of B cells. Okay. Let me just take it somewhere. Wait. Okay, number 4, that is the conversion of B cells into plasma cells. Conversion of B cells into the plasma cells. Okay, and production of the antibodies. Okay, so thus I can say removal of the bacteria and support of the humoral or cell mediated immunity. These are the major functions of the lymph nodes. Okay, so therefore I can say removal of bacteria, very important, removal of bacteria, and support for humoral and cell mediated immunity. Okay, these are the major functions of the lymph nodes. Okay, talking about the structure of the lymph nodes. Okay, the structure of the lymph nodes, it has a convex surface and a concave area, that is the hilum. Okay, so you can see this photo first. So it has this hilum wala part. Okay, and this entire convex surface. Each lymph node, it receives the lymph through many afferent lymphatic channels. You can see a lot of afferent lymphatic channels are there, as you can see in this photo also. Okay, but only the each lymph node has only one efferent lymphatic vessel through which the filtered lymph leaves through the hilum. Okay, so the lymph node receives the blood vessels also through the hilum only. So you can see in this area hilum, the blood vessels, the artery and the vein are also received. So this is one efferent one. Okay, so we have this, let me highlight, we have this efferent lymphatic vessel and multiple afferent lymphatic vessels. ठीक है, ये मल्टीपल हो गया, इसको अलग अलग कलर से कर लेते ताकि यू रिमेंबर दिस. ठीक है, so talking about this lymph nodes, so you can see this flow chart to understand things better. So lymph node, it has a capsule, parenchyma, reticular network, meshwork and sinuses. Okay, here you can see the cortex and medulla is the further bifurcation of parenchyma. Okay, and I am highlighting the very key important areas, although you will study more in detail in the histology section. There is a subcapsular sinus just beneath the capsule, okay, which is very important. It receives the lymph from the afferent vessels. Then there is a trabecular sinus which it connects to the adjacent trabecula and connects the subcapsular sinus with the deeper medullary sinuses, okay. Then the medullary sinuses which lie along the medullary cords and they drain into the efferent channels, okay, efferent vessels. So that is about the main, and rest you can read through in this flow chart, although we will cover everything in detail in the histology, okay. So I have just added it here so that you get sensitized to this topic. So you can see there is a subcapsular sinus which is shown here. If you can appreciate, I am zooming in. This is the capsule, okay. This is the capsule which is outlining it, and this subcapsular, okay. Capsule के just deep में you can see this sinus, empty space, okay. This is a sinus, and you can see this entire region. This is the cortex, which is again divided into superficial and deep cortex. So superficial is a nodular cortex, which you can see the nodules are there, the lymphatic nodule, and the central pale staining area, that is the germinal center. In between them you can appreciate the trabecula, which is running through this superficial cortex. So I can say superficial cortex, it shows the presence of numerous lymphatic follicles. Then deep cortex that lies between the nodular cortex and the medulla. So below it is the medulla. So superficial cortex and medulla के बीच में sandwiched है, we have the deep cortex. Then we have the paracortex, which consists of only T cells, hence it is also known as thymus dependent cortex, okay. Then we have the structure of the medulla. Okay, this medulla, central region. Medulla, it has the inner part of the lymph nodes, so it contains many medullary cords, okay, medullary cords, medullary sinuses. And what are medullary cords? They are anastomosing cords of lymphocytes, macrophages, plasma cells, okay. And medullary cords, they mainly consist of B cells in addition to the plasma cells and macrophages. Then you can see the empty spaces, the medullary sinuses, okay. So these are the spaces which separate the medullary cords. They converge, all of them are converging at the hilum, okay, and they form the efferent lymphatic vessel, as you can see in this photo. Okay. Rest of the things it is written what is where, which cells are present where, okay, so you can remember this. So talking about the clinical integration of this area, okay, clinical integration. There is something known as lymphadenitis. Lymph adenitis, okay, lymphadenitis. So inflammation of the lymph node is known as lymphadenitis. In lymphadenitis, the lymph nodes, they become enlarged due to the proliferation of the lymphocytes. So what are the causes of lymphadenitis? That is infection, spread of cancer cells to the lymph nodes like the metastasis. What are the symptoms? So patient will experience the swollen or painful lymph nodes, and fever can also be there. Lymph nodes, they become palpable only after they enlarge in infections or cancerous conditions, okay. Then there can be metastasis to the lymph nodes. Metastasis to the lymph nodes. We have already covered these words in the general anatomy first class, introduction to immunology, if you remember. So metastasis, so loose cancer cells from the primary cancer lesion, they get trapped in the lymph nodes, and this is also as per competency, if you remember, the lymphatic spread of the cancers. So these cancer cells, they can multiply in the lymph node and they can form secondary cancer lesions, and most common route of spread of cancer, that is through the metastasis, is through these lymphatic vessels only, okay. So we have already seen the structure of the lymph node. Then we come on to the thymus. Now thymus and bone marrow, they are the primary lymphoid organs, if you remember. So thymus is the one which continues to grow from birth till the puberty and then undergoes gradual atrophy, which is known as thymic involution. Okay, you will read about this later also. Okay, so what are the functions of the thymus? So it's performing the functions like education and maturation of T lymphocytes. ठीक है, functions में maturation of T lymphocytes, okay, to provide isolated environment for T lymphocyte maturation. Okay, so then you have the secretion of thymoprotein, okay, thymosin and thymopoietin. Okay, these are by the epithelio-reticular cells, and thymopoietin, this is the one which stimulates the T cell production. It stimulates the T cell production. Okay, then talking about the functions of the thymus, we have already discussed. Then the structure. So structure of the thymus, it includes the capsule, parenchyma and epithelio-reticular cells. Okay, and this is the medulla. Cortex medulla to hoga hi, theek hai, like any other. Okay, so I am here also highlighting the key features of thymus. Very classical and very important. Let me put it in another color. That is the Hessel's corpuscles. Okay, so they are the hyaline material surrounded by concentrically arranged epithelio-reticular cells. Okay, what else you have? The cortex, okay, and the medulla, which has these Hessel's corpuscles. The there is a thin connective tissue which is that capsule, and then it sends off septae which divides the thymus into incomplete lobules. Okay, so let me show you this photo, you will understand better. You can see this capsule which is sending further trabeculae. Okay, so you can see this cortex, dark granular area and light staining. This is the medulla, and you can appreciate some Hessel's corpuscles. We will discuss this Hessel's corpuscles in detail in histology again. Okay, so don't worry. So this Hessel's corpuscles are also known as the thymic corpuscles. Okay, these are the Hessel's corpuscles. Or the thymic corpuscles. Okay, just wait. They are the thymic or the Hessel's corpuscles. So this is a very unique feature of the thymic medulla. Again, very important point to remember. Okay. These are small rounded or ovoid structures which are present in the medulla. So it consists of eosinophilic hyaline mass, as you can see here. Again, this is an MCQ itself. Eosinophilic hyaline mass, okay, at the center, which is surrounded by concentrically arranged type 6 epithelio-reticular cells. It appears to be like an onion peel if you see. Okay, so Hessel's corpuscles, they represent the degenerating thymocytes, and their number, it increases with age. Okay, so it is very important. It represents the degenerating thymocytes. Okay, the number increases with age. Okay. Then we have something known as the blood thymic barrier. Okay, blood thymic barrier, which is again formed by this only. So blood thymic barrier, it's like the immature T lymphocytes. They mature in the thymus in an isolated environment. So they are prevented from exposure to the antigens by this blood thymic barrier. Okay, so this isolates the T lymphocytes from the connective tissue. So what will be the components of this blood thymic barrier? Let me mark here. The components, what are these? The capillary endothelium. There are three components: the capillary endothelium with the basal lamina and few pericytes. Okay. Then perivascular connective tissue, with few macrophages. Then type 1 epithelio-reticular cells. Okay, so although in detail we will go in the histology. Okay, so don't worry on that. Talking about the clinical integration, the very important disease, that is the myasthenia gravis. Okay, so it's a rare autoimmune disease. It is associated with 70% cases of thymoma, that is tumor of the epithelio-reticular cells. And in this myasthenia gravis, the antibodies, they are slowly destroying the cholinergic receptors from the skeletal muscle, and this causes weakness of the muscles. That is why myasthenia means muscle ka weakness basically. Okay, so this results in double vision, like the eye, involving the eye muscles, drooping of the upper eyelid, ptosis. Then dysarthria, that is muscles of the throat are also involved, larynx, जो मेरी अभी बहुत सारा यूज़ हो रही है इस टाइम पे, ठीक है, and there are a lot of muscles. So this is something related to the myasthenia gravis. Then we come on to the next entity, that is the spleen. Okay, now talking about the spleen, it's the largest lymphoid organ, and it is located in the upper part of the abdomen along the 9, 10, 11 ribs. Okay, that also we study in the gross anatomy in detail. Okay, so you can appreciate here it again has a hilum. Okay, a structure through which area through which the vessels will come enter or go out. Okay, so it has again as a hilum, or you can see hilus is written here, through which the splenic vessels they are entering. Okay, then what are the functions of this spleen? The functions include, you can see here, functions which includes the it performs the immune system functions as well as hematopoietic function, such as the activation of lymphocytes. Okay, so activation of lymphocytes is very important, induces the immune response. It is a site for proliferation of T and B lymphocytes. Okay, so then you have that is the multiplication only, okay, proliferation and activation. Then it helps in the destruction of the old and damaged RBCs and the platelets. So that is why it is known as graveyard of RBCs. ये शायद सुना भी होगा, NCERT में लिखा हुआ था. In embryonic life, the spleen acts as a hematopoietic organ, and this also stores some small quantity of blood. Okay. Then classically it has the capsule and the trabeculae and the parenchyma, which has very important feature and classical feature, that is the white pulp and red pulp. This is very much peculiar to this spleen only. Again we will discuss in histology in detail, so don't worry right now. Just sensitizing you here. So you can see this photograph. This is the histological image of the spleen. So you can see the scattered area here. Okay, so this is okay, this you can appreciate, this is lymphatic follicle only, okay, with the germinal center in the between. Okay, so this part is the white pulp and the rest of this area is the red pulp, and you can see the trabeculae which are extending from the capsule below. Okay, then some eccentric arterioles which are present in this lymphatic nodules, these are also classical features. Okay, so white pulp is forming the grayish white areas which are scattered throughout the substance of the spleen. Red pulp is surrounding the white pulp. Okay, so then you have the another concept, that is the splenic circulation. Okay, so talking about this splenic circulation here. Okay, so what is a splenic circulation? So there are two concepts of this. One is the open circulation and another one is the closed circulation. Okay, so now understand, the open circulation is having the sheathed capillaries which are opening into the red pulp, and the blood passes through the cords of the red pulp and finally enters the splenic sinusoids. Okay, so you can see open, ये जो green color के arrows बनाए हैं यहाँ पर, it is the open circulation. Okay. So another one is the closed circulation, that is having the capillaries which are opening directly into the splenic sinusoids. Okay, so you can see the capillaries which are opening into the directly into the splenic sinusoids. So this is the key word to remember here, and although we will remember this again in detail in the histology, but I am just writing it for your understanding. The closed one means the capillaries they open in directly into the splenic sinusoids. Directly into the splenic sinusoids. Okay? Whereas the open one open circulation, the sheathed capillaries they open into the red pulp. Okay, and the blood passes through the cords of the red pulp, and then further it enters into the splenic sinusoids. Okay, ultimately the blood has to enter into the sinusoids only. Okay, as you can see in both cases. Okay, and for your understanding and remembrance, in humans we have only open circulation in the spleen. Okay, so in humans we have open. Okay, whereas in dogs and rats we have the closed circulation. ठीक है. Okay. Next we move on to the clinical integration. Clinical integration of the spleen. So spleen के साथ related एक condition है, that is the splenomegaly. Okay, splenomegaly is the enlargement of the spleen. It occurs because of the immunological or hematological causes such as abnormal RBCs like thalassemia, sickle cell anemia, the immune disorders, the infections like malarial infection, splenic abscess, typhoid fever, okay, rheumatoid arthritis, and in cancerous conditions such as leukemia, obstruction to venous blood like cirrhosis of liver, obstruction of portal vein. Then you have something known as splenectomy. Splenectomy. Okay, so it is a surgical removal of spleen. What are the indications of splenectomy? Like the injury to the spleen, cancerous conditions again like the leukemia, severe hemolytic anemias, and so on. So patients after the splenectomy, they do not respond properly to the infections. Okay, next we move on to the epithelio-lymphoid system. Okay, what is this system? So this is consisting of MALT. We discussed that already. It consists of MALT. Okay, so what is MALT? It is mucosa associated lymphoid tissue. Okay, so it consists of two types. This this epithelio lymphoid system, this is consisting of two types, that is the GALT, GALT, and you have BALT, BALT. Okay, so G and B, so G is for gut associated lymphoid tissue, then B is for bronchus. Okay, like M is for the mucosa. Okay, so well defined MALT, this aggregates, these are aggregates which are including what all structures? The MALT, it includes the tubal tonsils, the tubal tonsils, okay, then the pharyngeal tonsil or the nasopharyngeal tonsil, okay, palatine tonsil, and the lingual tonsil. Okay, so all of these are included, and along with that we also have the Pierce patches, and Pierce patches are the classical feature of ileum. Okay, so Pierce patches in ileum. All right, so then we come on to this palatine tonsil. So this again you might be wondering what is this. This is known as the Voldier's lymphatic ring. Okay, that also we'll talk about in the head and neck region. So this is the area of the sagittal section taken at the head and neck region. So here this is the ring which is present here, which is isthmus, which is the opening. Okay, so we will discuss this in the sagittal section in detail, so don't worry about that. Okay, so you can see this is the opening of the mouth. If you just see yourself, open your mouth and see in the mirror, so you can appreciate this uvula very easily. Okay, so this is a soft palate, and you can see this arch and this arch. Between these two arches there is a sandwiched tonsil on either side. This is the palatine tonsil. We will discuss this arches separately again in detail, what all these, because soft palatic chapter here we will discuss that. Okay, so this is the tongue which you are seeing here. This is the posterior pharyngeal wall. So this is the palatine tonsil. Okay, so palatine tonsil is the largest tonsil in the group of the tonsils. Okay, it is the largest tonsil. It is the largest tonsil. Okay, so it is located on either side of the oropharyngeal isthmus. Okay, so this is the opening. All right, and this oral surface of the palatine tonsil is covered by the non-keratinized stratified squamous epithelium. That also we have covered in the previous class, if you remember. So functions, it produces the lymphocytes, antigen presentation, development of immune response. Okay, then you have the pharyngeal tonsils or the nasopharyngeal tonsils, tubal tonsils, lingual tonsils, Pierce patches. Okay, all these we will discuss in detail later on, so don't worry about this. Okay, then talking about this clinical integration here. So aggregation of the tonsils around the naso and the oropharyngeal isthmus, this forms the Waldeur's tonsillar ring, which includes all these 4 tonsils which we discussed. Then we have something known as the tonsillitis. नाम सुना ही होगा मे बी. Tonsillitis is inflammation of the tonsil. Itis लगा हुआ है. So it is caused by the viral or bacterial infections. Then you have tonsillectomy. Ectomy means removal. So surgical removal of palatine tonsil. This is usually required in the children which have recurrent tonsillitis, and that is known as repeated infections, that is known as adenoids. Okay. So the Pierce patches are ulcerated in typhoid fever, which forms the ulcers which are typhoid ulcers. Then you have something known as adenoids. Adenoids are the enlarged pharyngeal tonsils due to the infections. So it can obstruct the nasal respiration and make breathing through the mouth obligatory. Okay. So this is the clinical integration of this tonsils. Okay. We also discussed the Waldeur's lymphatic ring and we also discussed the Pierce patches. ठीक है. So we have tonsillitis, tonsillectomy, Waldeur's lymphatic ring, adenoids and Pierce patches. ठीक है. Next we come on to the immunity. Okay. So immunity, this is the last. Immunity is the ability of the organism to resist a particular infection or even a toxic substance with the help of antibodies or activated white blood cells. So there are classically 2 types of immunities, that is the innate immunity and acquired immunity. This you will study more in detail in the pathology and physiology also. Okay. So innate immunity or the native immunity, which is present at the birth. Okay, very important, and it is it provides non-specific protection against all types of infections. Okay. Then you have acquired, which is further divided into active and passive immunity. So active or the passive immunity. Active immunity is acquired by the individual on exposure of the antigen or toxins or microorganisms. So during exposure, what happens, the immune cells, they get activated and impart the acquired immunity. Okay. Then you have the passive immunity, which is acquired by the transmission of the antibodies. Okay, transfer of the ready-made antibodies are given to the patient, like immunoglobulin injections. Okay. Suppose if the person has already bitten by the dog, okay, and it's a very severe wound, okay, like a 3rd degree wound. So in those cases, what will happen, you will give the rabies immunoglobulins, okay, anti-rabies. So you give the injections. Okay. So that is another concept which you will understand better in the community medicine. Okay. So that is about the immunity. Then so you can see the cells of the lymphoid system, which includes the T cells, B cells and the natural killer cells or NK cells. So the lymphocytes, they are nothing but the subsets of white blood cells only, which form the major component of the lymphoid tissue. So T cells or the T lymphocytes, then which have further classification into memory T cells, helper CD4 T cells, cytotoxic CD8 plus and suppressor T cells. Okay, so you will study about them in quite detail later on. Okay, so I'm not going to too much detail. I've given you the flowchart here in the general anatomy section. You can read about it. Almost everything you have studied in the NCERT also, and again it will be repeated in physiology also, so you don't need to worry. And you can just revise this topic because this is quite lengthy. Immunity is a full-fledged chapter which I possibly cannot cover here in 1 hour. So that's about the cells of the lymphatic system. Okay, and that completes our topic. So thank you all. I hope you have understood this topic well, and please keep on revising. Don't miss the topics. Take care. Bye bye.